The Department of Otolaryngology at the St. Luke's Medical Center has been one of the nation's leading centers for the treatment of diseases of the ears, nose, throat, and neck for over 25 years. With programs in head and neck tumor surgery, hearing loss and ear disease, laryngology and voice disorders, disorders of the nose and paranasal sinuses, and facial reconstructive and cosmetic surgery, the department has been well known for its wide range of expert clinical services. The department was established as an independent specialty in 1987 when the old department of ENT was divided into the Department of Ophthalmology and Department of Otorhinolaryngology Head and Neck Surgery. The first chairman was Dr. Elvira L. Colmenar, an eye, ear, nose, and throat specialist, and its vice chairperson, Dr. Milagros Lopez. A residency training program was conceived and implemented.
As head, preparing all and asking the head of the hospital, Mr. Ledesma, to give us a room for a separate ENT department as an outpatient and as instruments preferably in the OR, which we need as requirement. I wish that department will continue to grow and improve it more than before as the years go by. Good luck and happy 25th anniversary again.
Dr. Bernabe Singson, one of the country's first ENT-trained specialists, was appointed as the department's first resident training officer, with Dr. Alex Benaventura as its first resident.
The Department of ENT Head and Neck Surgery in St. Luke's was created in 1986. So the Department of ENT was separated into the Department of Ophthalmology and our department, which is ENT Head and Neck Surgery.
In 1990, Dr. Manuel Lim was appointed as the new chairman of the department. Staff reorganization was initiated at that time.
Well, Dr. Manuel Lim is really a good otologist, one of the foremost in the country at that time. Then he took over Dr. Colmenar as chairman of the department. He was appointed by the administration at that time. But unfortunately, he stayed only for a short term, 6 months or something like that. And he's really a very good professor also.
Before, kakapaka pa tayo eh. In fact, our grand rounds before, sometimes it was only me and Dr. Singson and Dr. Vicente in Toronto Canteen. That was our grand rounds before. And then, as time went by, more people attended. Actually, Dr. Lim, Manuel Lim, made it more academic. More people attended. He made the grand rounds what it is today. Like every Wednesday, Dr. Lim started that.
Instruments related to ENT were acquired, which were utilized to enhance the teaching and training of residents. Residency duty at that time was on an every other day basis.
I always tell this. What's this? Daily census? The daily census? When I used to endorse to Dr. Alex Benaventura, when I left, I had this big census. I said, Lex, ito na mga pasyente natin gagawin, 2. So, win ako ah.
In the middle of 1991, Dr. Eutrapio Guevara Jr., a renowned craniomaxillofacial plastic reconstructive ENT surgeon, took over the helm as the department's new chairman. Dr. Rene Toison was appointed vice chairman. He instituted changes in the department such as procurement of state-of-the-art equipment. He, the department, started to gear towards the direction of higher academic achievements and more rigid surgical training.
Dr. Manuel Lim had a short term of his chairmanship because he was appointed to the University of the Philippines Department of Otolaryngology as chairman. Then he convinced me if I can replace him here. But at that time, my concern is that the department is not even a recognized department. It's not an accredited department. We have an accreditation that is, irregular yung ating, our accreditation. So, I took that challenge. Well, of course, my foremost aim first was really to make the department as an accredited teaching training hospital.
In 1994, the department was granted full accreditation by the Philippine Board of Otolaryngology from 1995 to 1998. The succeeding years saw the growth of the department, offering postgraduate courses and conducting symposium co-sponsored by the department with noted international experts and specialists gracing the events. All the subspecialties of otolaryngology were up for their respective courses and greater improvements. To add to the medical center's ever-growing commitment to provide optimal medical care at par with the world's finest, the Department of ENT in 1998 established the Hearing and Balance Disorders Laboratory with state-of-the-art facilities for evaluating hearing loss, tinnitus, and imbalance problems.
As time goes by, we were able to convince, recruit some consultants in ENT, but they came from the different institutions. I think one of the best invitation at that time is that we have a very good facilities. We were able to have this audiology, hearing and balance center. We were the first to establish a voice and swallowing and sinus center in this country.
In February 2004, the Voice, Swallowing and Sinus Center was inaugurated. It was the first center in the Philippines to integrate all the ancillary services of the department. The center houses the laryngeal stroboscope, the flexible pharyngeal laryngoscope, and the computerized speech laboratory, among other machines. The year 2005 was a landmark year wherein major staff reorganization occurred. Dr. Benjamin Campomanes took over the chairmanship with Dr. Norberto Martinez as vice chairman. Notable is the assignment of ENT SLMC graduates to key posts. Dr. Rodolfo Rivera was named Chief Executive Officer and Dr. Joel Romualdez as Resident Training Officer.
Well, I think one of the major changes would be really the change of leadership. We had the young Turks coming in. We had most of the young consultants coming in to help me run the department. Then we had Rudy Rivera being the executive secretary. We had Joel becoming the residency training officer. So these were all young people coming in. So most of us had new ideas. Well, of course, we started to assimilate all the graduates that we had. The young graduates started to come in, and we encouraged them to have subspecialties. So most of the people coming in during my time specifically had their own subspecialties.
As newer and better instruments were acquired by the department, an increase in the census of patients served was noted. The residents continued to involve themselves in various medical and surgical missions. Activities aimed at the uncompromising pursuit for academic excellence resulted in the resurgence of excellent scientific papers that garnered first place in innovations that resulted to better use of surgical instruments. Residents also landed the top spots for their respective year levels in the in-service examinations given by the Philippine Board of Otolaryngology, Head and Neck Surgery. In 2008, with the inauguration of SLMC Global City, Dr. Ray Casillo was appointed as Department Chairman of the SLMC ENT in Quezon City, with Dr. Benjamin Campomanes being appointed as Department Chairman of SLMC ENT at Global City. In 2010, with the opening of St. Luke's Global City, the department also branched into the new hospital with Dr. Campomanes as the first chairman, followed by Dr. William Lim. 25 years in existence, the department has produced 39 resident graduates. Dr. Alex Buenaventura was the first department graduate in 1990. In 1992, the department started to train 2 residents. And in 2010, with the opening of St. Luke's Global City, 3 residents.
I think the most special moments were when they pass the board exams. I think that's the most gratifying portion. You know that you have trained them well, and the outcome of their exams, of course, reflect on those who trained them.
The graduates, along with ENT specialists, form other institutions from the core of the department's active staff. To this date, there are 15 active consultants, 15 associate active consultants, and 19 affiliate consultants. This commitment to collaboration and innovation coupled with the expertise of our physicians, has allowed us to create a high sought-after residency training program, attracting young physicians from around the nation and the world. More advancement, expansion, progress, and achievements have been made during the past years for the department. The department had soared high, reaching realms of excellence in the area of training, technology, and service.